Good morning, everyone. Okay. Welcome to Pediatric Grand Round. Today's speaker is one of our very own, Dr. Kirsten Madea. She's a third-year resident in the pediatric program. Kirsten hails from Lancaster, Pennsylvania, and attended VCOM School of Medicine in Blacksburg. She has a long history of interest in community service, integrative medicine, and adoption medicine. On graduation, she plans to stay regionally close by and practice integrative medicine. Please welcome Dr. Kirsten Madea.
Thank you, guys. Good morning. Thank you for your attention this morning. So I wanted to do an introduction to Integrative Pediatrics, and I wanted to start off with a story as to what led me to pursue this. There are many different things that led me to this interest, but I remember my intern year at the end. I was in my continuity clinic, and I had a 5-year-old well child check, and this little guy was pretty much healthy except for some chronic constipation, and I was going over a prescription for Miralax with this mother, and her comment to me was, oh no, that's the same as antifreeze. I don't want to do that for my child. I've read all these blogs about Miralax, and it's not safe. Being an intern, I just kind of paused and was trying to control my face, and I was like, what do I say? I'm not sure what to say right now. And I said, well, what would you like to try? So she said, well, you know, I've been reading on all these colon cleanses, and I found one with a good review. And I said, oh, okay, what's the name of it? And she mentioned a name, and I said, I'm sorry, I've never heard of it. What are the ingredients? And so she pulls it up on her iPhone, and she shows the colon cleanse to me, and we look at the ingredients together. It was names I had never heard of, nothing I recognized. And again, I'm trying to control my face, and I thought, oh no, I don't know what to say to this woman about a colon cleanse in her 5-year-old for chronic constipation. And I said, excuse me, ma'am, I'm going to go see if I can look up these ingredients and find out more information and talk to my attending physician. So as an intern, you get a little bit more time with your continuity patients, and I think I spent more time that day trying to look up these ingredients of this over-the-counter colon cleanse for her 5-year-old. And I couldn't find a lot of data. And I talked to my attending, Dr. Meyer, that day, and I said, well, how do I find information about patients? You know, earlier that day I had been reading about rotavirus, and all I could think of is, will this colon cleanse cause profuse watery diarrhea to the point where the child gets dehydration and dies, like so many children in the world with rotavirus? And I said, but then, you know, that's kind of extreme, Dr. Meyer, in my mind. What if this is safe for the child? What if I need to give the mother the benefit of the doubt that she can try this colon cleanse for her child? And he said, you know, I went to a conference at UVA, and there was a woman, I don't remember her name, but I'll get it to you. And so later that week, he found this woman's name. Her name is Dr. Kathy Kemper. She's a pediatric gastroenterologist. She's fairly well known in the field. And she's done a lot of research into complementary and alternative medicine within pediatrics. Specifically within nutrition. And so I reached out to her. I found her email online, because you can find anyone's email online, and she was very helpful. She led me to different textbooks, different articles. She connected me with a physician that does pediatric integrative medicine at the University of Arizona, and that's kind of how I fell into this. So today, I have no disclosures. So the objectives will discover the use of complementary and alternative medicine together in pediatrics and how it is used in the U.S. We'll define what is the specialty of integrative pediatrics. We'll critique over-the-counter supplements for safety and efficacy. We'll investigate the learning modalities available for providers about integrative pediatrics. And if time allowing, we will discuss integrative pediatric case presentations. So if all of you have a computer or your smartphone, if you could pull that out, we'll do a quick quiz. You go to kahoot.it. It will ask you to enter this PIN, so the 5660002. It will then ask you to put in a username. If you want to remain anonymous, I would suggest making up something because the usernames will pop up on the screen. Your answers will be recorded, whoever's question mark, question mark, question mark. And then we will see who's the winner. Uh-oh, we've already got a Don Keys out there. We've got a colon cleanse. Another Don Keys. Uh-oh. Who's the Don Keys? Who's the real one? For those of you that just walked in, we're doing a Kahoot quiz. So if you want to go to kahoot.it and put in this PIN 5660002, it will ask you then to come up with a username. If you want to remain anonymous, please make up a name. As you can see, as people sign in, their names are popping up on the screen. Still getting more players. All right, I think everyone's ready to go. Oh, I just got another one. Are you ready? Your Integrative Pediatric quiz. You've got 20 seconds. How much money do patients in the United States spend every year on alternative medicine? 18 billion, 28 billion, 38 billion, or 48 billion? Yes, they're all billions. Okay. So it looks like the majority of you chose the wrong answer. The correct answer is $38 billion a year is what patients in the United States spend on complementary and alternative medicine therapies outside of what their insurance will cover. All right, so who got that right? Team Hadley is winning at 825 points, and second place is At Home, and BK is in third place. I wonder if that's Brenna Keene. No? Brian, oh, Kramer, maybe? I don't know what that is. All right, next question. What % of children in the United States use complementary and alternative medicine? Is it 12%? Is it 31%? Is it 53? Or is it 86? Okay, so the answer is 12% of children in the United States use complementary and alternative medicine. So about 3 of you got that right. So it's not as high as you think. So more adults in the United States use complementary and alternative medicine than pediatrics. Next question. Oh, it looks like Anonymous 4 is in the lead, then Horse Hurl, Donkeys, Team Hadley, and At Home. Which condition do children use complementary therapies the most? Is it back or neck pain? Is it for head and chest cold, ADHD, or insomnia? All right. The answer is back and neck pain is the most common complementary therapy that people seek out. So it looks like most of you chose head and chest cold. That is actually a very, very, very close second, and you'll see here in a few moments how close it is. So who's in the lead now? Looks like Horse Hurl is in the lead. BK is second. Anonymous number 4 is still in the running here. And Don Keys with the K-E-Y-Z. And Team Hadley.
That's not original.
All right. What is the most common natural product used among children in the United States? Is it fish oil or omega-3s? Is it vitamin C, elderberry, or echinacea? All right. So again, most of you guessed the wrong answer. The actual correct answer is echinacea is the most commonly used among children compared to vitamin C, as most of you thought. All right. Let's see who's winning. Horse Hurl is still in the first place. Don Keith, close second. BK, Anonymous 4, and then whoever Tom is. Which of these activities significantly improve the symptoms of ADHD in children? Is it yoga, Tai Chi, meditation, or all of the above? That's what my husband said too, yeah. Anytime there's an all of the above, you have to pick it. Trying to make you guys feel better about your score. All right, yay, we got one right. Good job, guys. So all of the above, yoga, Tai Chi, and meditation all help with symptoms for ADHD. So let's see, who is the winner? Horse hurl. I don't know who that is. Anyone want to claim it? Yay! Oh, that was a typo. I was wondering, I was like, what does that mean, horse hurl? Okay. All right, and it looks like anonymous 4 and then anonymous 2. All right, so back to our presentation. Good job, guys. So the National Health Interview Survey put out by the National Institute of Health says that 12% of children use some form of complementary and alternative medicine. That's what that acronym from here on out for this presentation, CAM, it represents. Children whose parents use complementary and alternative medicine is about 23.9%. Adolescents between the ages of 12 to 17, about 16% of them use alternative medicine. Whites at 12.8%, Hispanics at 7.9%, and blacks at 5.9%. Others were not listed. Children whose parents have a higher education level, and that's anything greater than a high school education, have a higher rate of using complementary and alternative medicine at 14 to 17%. And children that have 6 or more health conditions, so children that have chronic health conditions are more likely, at 23.8% of them report using complementary and alternative medicine. Children whose families say that they delayed conventional care because of cost, about 16% of those that delay care are actually using complementary and alternative medicine. Adolescents that say that they are homeless, it's very high, 30 to 70%, depending on which studies you look at, report that they use some sort of alternative medicine instead of seeing their primary care doctor. $127 million is spent on pediatric alternative medicine visits alone per year, and then $22 million on complementary and alternative medicine therapies, so outside of the visit cost is used. So the NIH breaks down complementary and alternative medicine. This is data from 2007, which is the most recent that they have collected. As you can see here on the x-axis, you have your ages broken down into different categories, and then on your y-axis, you have the percent. So children, as you can see here, 0 to 4, 5 to 11, and 12 to 17, not as common as your adults and middle-aged or even your elderly patients using alternative medicine. And here's the graph to break down the 10 most common therapies used among children. You can see that natural products at 3.9%, chiropractic and osteopathic at 2.8%, deep breathing exercises at 2.2%, yoga at 2.1%, then homeopathic treatments at 1.3%, traditional healers at 1.1%, massage at 1%, meditation, diet-based therapies, and progressive relaxation even smaller. So the diseases and conditions that complementary and alternative medicine is most frequently used among children include that back and neck pain at 6.7%, but those of you that guessed the head and chest cold is 6.6%, so very close second. And anxiety and stress at 4.8%, musculoskeletal complaints other than the back and neck at 4.2%, and ADHD at 2.5%, and insomnia is the very last there. Let's go over some terminology, because you might say, well, Dr. Madea, I thought you were talking about integrative medicine. Why are you using the word complementary and alternative medicine? So first, let's define what conventional medicine is. This is what the majority of you in the room are familiar with and what you practice on a daily basis. This is where you collect a traditional history and physical by either a medical doctor or doctor of osteopathic medicine, and you prescribe medications as needed. When you use the term complementary, this is literally anything that, quote, complements a conventional treatment. So this could include a nutrition counseling, dietary supplement, mind-body therapies, or things like bioenergetic treatment. So then what do we mean when we use the word alternative? When you hear the word alternative, this refers to the use of non-evidence-based therapies that are in place of conventional medicine. Okay? So the broad term complementary and alternative covers both evidence-based, that complements conventional therapy, and those that are non-evidence-based. Okay? This is why we've moved to using the term integrative medicine. Integrative medicine is not the same thing as complementary and alternative medicine. Integrative medicine is this bridge between conventional medicine and complementary and alternative medicine. But if you look here in the light blue of this Venn diagram, integrative medicine is using what's evidence-based only. So to define integrative medicine a little further, the emphasis really is on that preventative health. So it fits well with pediatrics. Using conventional treatment as needed. Using only evidence-based complementary therapies. And having an openness to blending both the conventional and the evidence-based complementary therapies for the highest benefit of the patient's health. But what is the definition of health? And so I put up the World Health Organization, their definition, and they say that health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I thought this was interesting. This was the preamble to their Constitution of the World Health Organization way back in July of 1946, and they've not amended this definition since 1948. So I thought that was a useful definition. So some of the principles of an integrative practice, again, that preventative health as well as lifestyle is really important. You want to support the individual's innate ability to heal. You focus more on the therapeutic relationship between the patient, the family, and the clinician. And you consider everything about health, including the mind, the body, the spirit. You want to make it family-centered and also culturally competent. And this is very important to maintain cultural competency and sensitivity when discussing complementary and alternative medicine with families. Many families either they'll use these therapies because it's a religious reason or it's a cultural belief, and it's very personal. And they oftentimes believe in this stronger than conventional medicine. And of course, you want to use only evidence-based therapies. So you may look at some of these principles and say, well, this is very much what we all try to achieve. And in integrative medicine, the specialty really pushes to spend more time with the patient, billing for your time that you spend, and scheduling longer appointments than those 10 or 15-minute appointments. And so hopefully we'll get to just prescribing things like exercise or healthy eating is the goal. So what does the AAP say about integrative pediatrics? Well, it is supported by the American Academy of Pediatrics. It was established in 2006. They made a provisional section on complementary, holistic, and integrative medicine was the term, but that term is now changed. It's been renamed. In 2011, it's now called integrative medicine. So they did a survey of the 1,607 members, and they said, how many of you were asked about complementary therapies over the last 3 months by your patients? 87% said that they had been asked. So it's the majority of us. The most common inquiries were about dietary supplements, then followed by chiropractic and nutrition. 39% of the surveyed pediatricians indicated that they or their family members used complementary therapy over the last year. So if we guesstimate, that means maybe 10 to 15 of you sitting here in this room have used alternative or complementary and alternative medicine therapy in the last year. So the parental views of integrative pediatrics. So what pushes parents to pursue this? They really turn to this field because they want to fill a gap that they feel like conventional medicine is not fitting. They cite concerns about the side effects of prescription medications. They also say that there's a lack of access to care that's consistent with their personal values. And parents often fear this negative reaction from their child's clinician to even talk about it or bring it up. And so that leads them up to 66% of parents say they will not discuss this with their primary care pediatrician. They won't even tell them that they're using a therapy on their child. So the areas that we explore in integrative pediatrics is all throughout development. So typically, we look at the health issues just like any other healthcare provider. We go into the nutrition in detail. We look at their level of physical activity. We assess sleep. We go into stress management and toxic stress. We discuss their mental health and environmental influences and relationships. So just as you would look at a seed that you have in your hand and you envision the whole plant, or you look at a tree and you look at its roots that you're not even, and you can envision that, you might not be able to see that. That's exactly how you view a patient. So pediatricians look at their children that are sitting before them and they see what is their potential as well as what is the foundation of this development and how can we fix that. Again, very consistent with what we practice in pediatrics anyways. So the integrative interview. So it's not meant to replace what you and I know as a comprehensive medical history. It's solely expanding and augmenting this. We've got data that says patients get better faster if they think their doctor is listening. So that includes parents. So the data also replicates that if a parent thinks you're listening, the child gets better faster. So it's really important to take the time and use phrases like this. Well, for the first 60 seconds, I don't want to hear about why you are here. I want to get to know you and your family. Or you could say something like, well, what do you want your health for, if you're talking to an older child, or what are your 3 top health goals? Or using whatever phrase seems to work for you. And the simple fact of drawing the attention of that parent or that patient to a phrase in the beginning that's very unusual from their usual appointments, it's showing them I'm not just making small talk that you're going to forget in the next couple hours, but I'm drawing your attention to that I'm trying to make a relationship here with you and I'm trying to get to know you beyond what others typically do. And that's especially important. That relationship and trust is especially important if they're using a therapy that you then want to tell them to discontinue or advise them that it's time to stop. Okay, so the integrative interview is very important for establishing trust with families. As you interview a family, you might find out that they really don't know what you're talking about when you say the word integrative or complementary and alternative medicine, so you can just avoid those terms in general unless they bring it up to you. But it's really important to ask them, are you using any herbs or supplements or vitamins or minerals? Are you using any products from a health food store or maybe a natural food store? Are you using massage, chiropractic, or any forms of physical manipulation? Do you practice any forms of prayer, meditation, faith, or spiritual healing? Some other topics you could discuss would be things like their personal childhood or the parent's childhood. You could talk to the child about their own relationship with their parents or their siblings. You could talk to them about significant others if they're old enough to have that. And then discover what is the nature of these relationships. This often will give you a good key about chronic illnesses and why children even have them. You could ask them, well, what brings you joy in life? Very helpful to understand. What matters to you in life? What do you think has changed your life? And what do you perceive as your strengths and weaknesses? And sometimes these questions are more pointed towards the older children, but even asking a parent, what is your child's strengths and weaknesses, will help you as you develop that relationship with this child as they go through development and grow older. What do you see as a source of stress? And I like this question, and I think it really reminds us about all of the people out there that do not have the ability to pay for maybe food and shelter, or the decision is, do I spend the money to pay my electric bill today, or do I go get extra food? And it's always good to remind yourself, what is their source of stress? What is the parent or the family's spirituality? What is the family's diet like? How does the family exercise? How does the family define habits? What are their habits? And what do they do to relax together? So some of you may view integrative medicine as bits and pieces of things that you've heard. So I wanted to put this graph together and go over, well, what exactly are all the different types of practices. So you can break it down into kind of 5 different categories. You have whole medical systems, and this is where people practice homeopathy, naturopathy, Ayurvedic medicine, traditional Chinese medicine. You have a category called mind-body medicine. This is where it includes meditation, prayer, mental healing, things like creative therapy, art and music, or dance therapy. Then you have your biological-based practices, and these include all of your supplements and botanical medicines. And then you have manipulative and body-based practices, and these would include chiropractic or osteopathic or massage. Then you have energy therapies, and these are your biofield therapies known as Qigong, Reiki, and therapeutic touch. And then you also have bioelectromagnetics, using electromagnetic fields for healing. So most complementary and alternative medicine therapies have not been adequately reviewed for pediatrics. So there's a small but yet steadily growing body of literature on complementary alternative medicine. So when you're talking about any sort of alternative medicine with a family or a parent or a patient, it's really important to engage them into the conversation and use these 2 questions. Is the therapy effective, and is the therapy safe? So I like this chart, and this is put out by Dr. Kathy Kemper in a textbook called Holistic Pediatrics. And as you can see here, when talking to your patient, is it effective? Yes. Is the therapy that they're wanting to try safe? Then go ahead and recommend it. Is the therapy effective, but it's not safe? And this is the conversation that's very difficult. This is the point where you want to say, well, but then we really need to closely monitor you if you want to continue to use this supplement because it's not known to be safe in children, or you just discourage it, okay? But then there's this large category that I think you will encounter that you'll see a lot of supplements or a lot of therapies out there that are not known to be effective in children, but yet they pretty much are safe. So you can tell the parent, you know, it's okay to use it. It's more or less for you as a provider to just tolerate that due to the relationship being more important at this point. And then, of course, if the therapy is not effective, it's not safe, this is where you just strongly discourage it. So what does the Food and Drug Administration do about supplement regulations? So they have a couple regulations listed here. So they say that you have to have a descriptive name stating that, yes, it is a supplement. You have to have the name and place of business of manufacturer, a packer, or distributor. You have to have a complete list of ingredients. You have to have a nutrition labeling. It's called a supplement facts section. You have to identify each dietary ingredient contained in the product. So let's look at an example here today. I picked a random one just to fit with the color scheme. I have no disclosures, no stock in this product. So we have here Echinacea purpura. It's an herb. It's listed. At the very, very bottom, I don't know if you can see it here, it's in green, and it says it's a dietary supplement, so it meets that qualification. Over there on the far right, you have the recommendation as to how much to take. And so they said take 3 capsules 3 times a day with food. They also have a cautionary statement here that if you're pregnant or if you're nursing or if you're taking any medications, consult a healthcare professional before use. I think all supplements pretty much have that statement now. But this one I thought was interesting. It says it's not recommended for individuals with autoimmune conditions. Persons with allergies to plants of the family, including ragweed, should not use this product or use it with caution. You can see that this label has that supplement facts, and it looks very much like a nutrition facts. And it tells you whether or not there's any carbohydrates, any fiber. It lists the Latin or the common name for the supplement, which is a requirement. It also tells you what part of the plant is being used. So it's the stem, the leaf, and the flower in this case. And at the very bottom, it tells you any other ingredients that might be in it. And this one lists silica, which I thought was interesting, as something that's in the capsule. And at the very bottom, it meets the requirements. It has the name of the company, where it was manufactured, and the contact information. So this would be an example of an FDA-approved label for a supplement. So let's dig into the history of supplement regulation so you have a better understanding. So in 1994, the Dietary Supplement Health and Education Act, the DSHEA, was established. And the FDA then authorized for what was called, quote, good manufacturing practice regulations specific for dietary supplements in the industry. And it took from 1994 until 2007, on August 24th, before they finally made a rule that says what, quote, current good manufacturing practices were. So this ruling applies to how they manufacture supplements, how they package them, or how they store the dietary supplements. And then it wasn't until August 2010 that they said that all manufacturers, no matter how small, need to be in compliance with this law. So it wasn't until recently, until about 8 years ago. I guess that's not recent. But. So the FDA's final rule on current good manufacturing practices established the requirements to ensure products are made in a consistent quality manner and are accurately labeled and free from impurities, and that's when it went into effect. So this document is over 800 pages long. It says that you have to evaluate the identity, the purity, the strength, and the composition of dietary supplements. You have to ensure labeling and products without adulterants, such as pesticides, bacteria, or heavy metals. You have to establish quality control procedures in both your designing and manufacturing plants, as well as your testing and the finished product. And you have to have provisions for handling consumer product complaints, like that label we saw had a contact number. But how do you know that all these companies out there are actually following the FDA guidelines? There's no specific entity that is testing all of the supplements. So there are a few third-party independent companies that will inspect some of the supplements that are out there. So those that are testing for good manufacturing products or processes include the USP, the United States Pharmacopeia. And just to remind you, the USP is what also checks all of our prescription and over-the-counter medications, making sure that every aspirin, whether it's name brand or generic, has the ingredients that it says it has without contaminants. So the USP, if you go to this website, there are some supplements and brand names that have been tested, but they do not test all of them. Then you have your National Sanitation Foundation, the NSF International. They also list, and that's more for your products that are coming from overseas if you want to look there. You have Natural Products Association, and then your consumer labs. And now, out of all of these resources, I think the USP and the consumer labs are the ones I would go to first to look for a supplement, specifically a brand, if you're wanting to know if there was a brand on the shelf that was known to have a contaminant or a heavy metal, or if it actually has the element that it's claiming to have inside the product. But our supplement quality really varies. So an example, the consumer labs, they decided to take a bunch of melatonin off the shelf just to test it. And this was after the year 2010 when the FDA said that all these regulations had to be enforced. And so they found 4 or 5 different melatonin brands, and they looked at them and they analyzed them. And so the ones that said they were 5 milligrams, they found that there was a variation in even the amount of melatonin that was in each of these. Up to 30% didn't even have melatonin in it, and it was about 1 to 2% ended up having contaminants or things that were considered heavy metals. So it's really important. And as I stated earlier, it's the FDA that enforces these standards through the U.S. Pharmacopeia for prescriptions and over-the-counter products. But they don't do this for all supplements. So U.S. herbal and supplement companies are supposed to comply, and they actually must comply with general quality, cleanliness, and truthfulness on the product's label. So they cannot make a false claim saying that this product will fix your hypertension or will cure your ADHD. If they cannot make false claims like that. And so then the means of testing products and identifying what's actually in the the supplement and the composition, it's not mandated. And companies are free to set their own standards for identity, chemical composition, and release of ingredients into the body. So there's a lot of variation. And I really encourage you that you really can't assume that one brand is the same as another. So when a patient comes to you or a parent comes to you and asks you about a specific company, I would encourage you strongly to look it up on the resources I provided and let them know that the one melatonin that you buy from CVS might not be the same as Walmart, and I can't guarantee it unless we look it up together. And really, the herbal products that you do end up looking up and you find out information, always make sure that they were clinically tested. And there is data on these websites, whether or not it's been clinically tested, as well as in adults and pediatrics. So I put a picture up here. This is the Natural Medicines database. You have access to this database if you have prescriptions to the pharmacist letter. Continuing education and continuing medical education credits are available for healthcare professionals through this. The American Academy of Pediatrics says if you're going to look up information about a supplement, this is the resource that you need to go to. It's updated daily, and there is a print version of this, but that print version is obviously going to go out of date and not have the correct information very quickly because this is the source that they take the time to update. The team that puts this together is made up of over 40 pharmacists, over 30 physicians in different specialties, over 20 different physicians also with a PhD. They have registered dietitians, naturopathic doctors, MPHs, MBAs, software engineers, et cetera. So here's an example of looking up a supplement within this database. And so I looked up echinacea, typed it in, took a snapshot of what all of the information is that you'd be able to find. So on the far left, if you're able to see that, I hope this print isn't too small for you there, but you can see they'll list what the scientific name is, what the background is of this supplement, what people use it for. There's a whole section on safety, whether or not it's safe. There's a section on effectiveness, the dosing and administration of it, and that dosing and administration is not just the adult dosing, but if there's pediatric data, they will list that there for you. There's also a section on adverse effects, depending on how much of a supplement you take or any case reports. They have a toxicology section, and they'll also list any drug interactions. That includes other over-the-counter drugs, prescription drugs, and other supplements. They'll list food interactions, lab interactions, what the mechanism of action is, any disease interactions, the pharmacokinetics, classification. So you get a lot of data through this website. Other tools that I like in this website is that you have an interaction checker. So if you have a patient on 10 different drugs, usually in pediatrics it's not that high, but in your chronic complicated patients that tend to use alternative medicine more frequently, it'd be really helpful to look at their list of medications, their list of supplements, type them into a database like this, and see if any of them are interacting. This also has a pregnancy and lactation checker, so that's important for those that are pregnant or breastfeeding. And right now our library does not have access to this database. And although this is what the American Academy of Pediatrics says is a reputable source to learn about herbs and supplements. At Carilion and Virginia Tech Medical School, both of them don't have a subscription, and hundreds of medical schools around the nation use this as their first line to look up. So there are free resources for you currently right now, but they're just not updated as frequently. They do not always incorporate third-party evaluation of products. And so there are medical legal issues that can arise if you have a patient that asks you about a supplement and you don't give them the correct information, or you say, sure, go ahead and use it. You could have a medical lawsuit. So I really would encourage us to go ahead and email the library. They say that they are willing. It all comes down to their finances, and they have a yearly budget meeting coming up. And so the more of you that email the library at carillionclinic.org, then we can get access to this database, I think. Lois Jane Burnett, because she goes by Jane, here's her personal email. I asked the residents would be able to get access, and she said we have to get our program advisor or program director, Dr. Reynolds, to approve of it if we all decide that we want this. And then for the Virginia Tech Library, Marguerite McClandless is who the students will contact if they want access to this. So here's a free resource that, in the meantime, until we get access to this, is the NIH puts out they have a National Center for Complementary and Integrative Health, and they have a section on dietary and herbal supplements. It's intended to give you kind of basic data, what any adverse effects that are out there, any case reports of adverse effects. It doesn't always have the best pediatric data when I look at it as much as the other database does. So how do you get further education and training in integrative medicine? So really after the year 2005, the Institute of Medicine put out a report about education in integrative medicine, and then it started to accelerate. So we now even have a pediatric integrative medicine fellowship put out by Stanford. This is the first year, 2018. They have their first inaugural class. As well as there's the University of Arizona Center for Integrative Medicine. They have a distance learning curriculum. It's a fellowship that you can do, literally doing modules online for 1,000 hours. They also give you a personal mentor within your field. So if you are a pediatrician or family medicine, they have a mentor that will help guide you to patient encounters and how do you use integrative medicine. If you complete a fellowship, then you are then eligible to sit for the boards, which is the ABOIM, and this is under the American Board of Physician Specialties, and that's been established since 2014. There are 24 other accredited fellowship programs in integrative medicine for those of you that are not in pediatrics here today. So if you're in family medicine, internal medicine, cardiology, if you just want to do more research, or psychiatry, or within geriatrics. Locations are all over the United States. So everything from Washington, D.C. to California, up north. Yay, I think we have time to get to our case presentation. Okay. And if you have questions, please feel free to interrupt. So we have a 7-year-old male who presents with his mother to your outpatient clinic. Chief complaint is, well, he caught a cold and I've got some ADHD concerns. This is a 15-minute appointment that's scheduled. So now you have the 15-minute appointment choice. What do I talk about first? Can I address this first-time ADHD complaint with this mother in 15 minutes? Probably not. Maybe I can address the cold today. And just to remind you that a truly integrative pediatric consult tends to bill based on that counseling, especially for ADHD patients, the time on counseling. An ADHD evaluation, really the minimum time that should be scheduled as perceived it by Integrative Pediatrics is a 60 to 90-minute appointment. And then that first follow-up appointment should be about 45 minutes. So these patients in integrative medicine, they see that you need to spend a lot more time with them. Okay, so we decide to go over his cold. He had 2 days of fever. He has a sore throat, rhinorrhea, a little bit of nausea but no vomiting. On physical exam, he had a little erythema of his oropharynx and some postnasal drip. His TMs, lungs, skin, they were all clear. His belly was soft. So you flew and strep swabbed him. It was negative. So you diagnosed him with a viral upper respiratory infection. So you decide to discuss with mom symptomatic care. So mom says, hold on a second. My kid is 7. He's now in school, and I feel like he gets sick with colds all the time. How do I prevent this? Well, let's talk about preventative measures. The flu vaccine, yay. So integrative medicine, yes, does support vaccines. Let me clarify that. So it's evidence-based. You need to make sure the child is up to date with vaccines, including the flu. Make sure the child washes their hands. Avoid picking their nose, touching their face, and that's something you have to teach a child. And there is some data on zinc for preventative medicine. So the 2011 Cochrane database had a systemic review that found oral zinc sulfate associated with a decrease in severity and duration of cold symptoms if it was taken within the first 24 hours of the illness. And in children, it was specifically studied, and it was found to reduce the number of school absences and the number of prescriptions received when it was taken over a longer time span, averaging about 5 months. Thought that was interesting. Probiotics have been studied. So there was a 2009 randomized controlled trial in pediatrics that studied children ages 3 to 5. They were given either Lactobacillus acidophilus or a combination of Lactobacillus and Bifidobacterium animalis. And this was twice daily for 6 months versus a placebo. The children in the treatment group ended up having a significant reduction in fevers, cough, rhinorrhea, and their prescription use and the numbers of days that they were absent. And they found that the combination product was actually slightly more significant. Other preventative cold measures, so vitamin C was studied. There was a 2007 Cochrane database systemic review. It found consistent benefit in upper respiratory infection prevention in 13% of children who took 1 gram of vitamin C daily versus the control group. So no difference was seen in actually the treatment of URIs. So if you got an upper respiratory infection, or at least in children, the vitamin C, taking it during the infection is not going to help you get better faster. Okay, so what about treatment for this little guy? Well, what is the supporting evidence? So things that you're very common, have common knowledge of and probably recommend on a regular basis, things like nasal irrigation, humidity, mucolytics. And some of you may recommend this. So cough suppression with dark honey, specifically buckwheat honey, has been studied in those greater than 1 year of age. Honey has been shown to be as effective or even more effective than over-the-counter cough suppressants with a significant safety margin, except for those under 1 year of age. We do not recommend it because of the risk of the botulinum toxin. If you want to know about dosing of honey, so the ages of 2 to 5, it's 2.5 ml. The ages of 6 to 11, it's 5 ml. Ages of 12 to 18, it's 10 ml. And they can do this every 2 to 3 hours for a cough. Elderberry actually has been studied for influenza. There is a liquid elderberry extract that exists for children. And it's also been shown to be effective to help shorten duration of strep pyogenes, both group C and G infections, as well as gram-negative Bronhamella cataralis. Then osteopathic manipulation has been shown to be effective not for acute otitis media, but for recurrent acute otitis media. And then there is homeopathy that has been studied for acute otitis media, and this actually has very controversial data. The American Academy of Pediatrics actually recommends to avoid using homeopathic medicine because there's been so many contaminants with heavy metals. So now moving on to, you've asked the parent to bring the child back in 3 days so we can check the cold, and let's talk about ADHD. But who really should be evaluating the child for ADHD is the question. I think many providers in the community have this question. Is it the pediatrician that's best, or is it the psychiatrist? Many pediatricians really aren't interested in treating ADHD. Maybe they have a passion about sports medicine or allergy and immunology, something other than ADHD. And so too often I think well-meaning doctors do an inadequate job because they do it in a 15-minute appointment. So a lot of times I think that pushes parents then to turn to complementary and alternative medicine therapies. So within conventional medicine, there's a long list. This is a little overwhelming, but for ADHD, as just a basic MD or a DO, it's recommended that we go through all of these topics to evaluate if the child even has ADHD. So you want to assess their sleep hygiene, rule out sleep apnea, look for an iron deficiency anemia, assess if there's a lead toxicity, make sure there's no learning disability or an auditory or visual processing disorder. All these things listed, it's very difficult to do in 15 minutes. Maybe this child has some boredom and they're a gifted child. Maybe the child has an intense or difficult temperament. Maybe they have oppositional defiant disorder or a sensory integration disorder, or maybe it's based on poor nutrition that they aren't eating well. Maybe they have a food sensitivity, or maybe there's some social issues going on at home, such as sexual or physical abuse. Maybe there is a mismatch between the child and the school, or maybe the child and the teacher. There may also be a discrepancy between parental expectations for behavior, and you need to assess the child's ability to function as well as their temperament, or maybe the child's being bullied. That's just basic ADHD evaluation within medicine. So within integrative medicine, you could take it just a little bit further. You could go in and examine the child's physical, social, and emotional history all the way from birth on. You could talk about the family dynamics and try talking to the parents alone. You can note the emotional state of the child and how he relates to the parents. You can look at the child's language ability and look at the degree of motor activity. Maybe the child's hyperactivity that's being interpreted by the parent is really a motor tic. There's so many different conditions that are misdiagnosed as ADHDs, like depression, bipolar disease, anxiety, learning disabilities, ODD, sensory processing disorders. And then the other thing in integrative medicine, they use the standard questionnaire just like conventional medicine does. Here we use the Vanderbilt, and that's given both to the families and the teacher. But then taking it a step further and actually talking to the teacher, I think, is really important because you'll see the parent in that visit. But a simple phone conversation is something you can bill for as counseling, and it's extremely helpful because the comment section on the Vanderbilt, maybe the teacher didn't have time to fill it out, maybe the comment that she wrote was not expressing how she truly felt about the child, and so getting insight from the teacher is very important. So now the mother asks you about supplements for ADHD. So you reassure her that, well, stimulants really are effective in more than 80% of children with ADHD, and that is first line of treatment. Optimum therapy can require dosage titration or several trials of several products, so you reassure that this might take time to control ADHD. Then you also reassure her, because this is a common concern among parents, is that stimulants will stunt their growth or cause future drug abuse. So reassure her for those concerns. And then let her know that there is some evidence that some pediatric ADHD patients have low levels of certain vitamins such as magnesium and zinc, and we'll talk about that in a moment. And then in these patients, vitamin supplementation may end up improving their symptoms of ADHD. But there's not enough reliable evidence to suggest that supplementation improves symptoms in patients with adequate vitamin levels. So there's no proof that using these megadoses, this is something that's commonly asked of, giving a large dose of a multivitamin or a large dose of any vitamin or mineral seems to help ADHD. It's a common perception. And let the parent know that if this is something that they're considering, that a large dose of any vitamin or mineral, when it's taken in a high dose above that recommended daily amount, should be avoided. So you go into supplements a little more in detail. Okay, so ferritin. Ferritin is a good, reliable biomarker of our iron stores, and low levels have been associated in some studies with ADHD. So the review of the literature has very mixed results, and there's a need for larger trials on this. But I would say it's very reasonable to go ahead and look for iron deficiency anemia. And that's something you can screen for, harmless. You could always give an iron supplement. But do remember that iron may not be safe for children if it's used in an excessive amount. So you do need to talk to the parents about the risk of taking too much iron. Zinc. Zinc is involved in many physiological processes, including neural metabolism. So children with ADHD that have lower zinc levels has been discovered, but that seems to be, most of the studies are overseas, nothing in the United States. Our diet tends not to have a deficiency in zinc. So I would take that data with a grain of salt here. Magnesium. Magnesium levels seem to be lower in children with ADHD, is what's been found. This is an important neurotransmitter, or it helps with important neurotransmitters. Preliminary clinical research suggests that taking magnesium aspartate at 6 milligrams per kilo per day might be useful in improving hyperactivity in children between the ages of 7 and 12 with ADHD and low magnesium levels. And then vitamin D has a role in a variety of immune and neurological functions. And some studies correlate low levels with increased ADHD symptoms, but really there's no randomized control study, and the data is really lacking on that. Other therapies that you might be asked about are amino acids. So supplementation with individual amino acids really has a lot of risk and there's some adverse effects. So take, for example, tryptophan. There's a lot of impurities that have been noted to be in supplements that have tryptophan, and it's been linked to probable immune disorders such as eosinophilia myalgia syndrome. There's been a concern about that it possibly can turn into a carcinogen once it's processed within the gut, so limiting that. Omega-3 fatty acids actually has been studied and had a double-blind randomized control trial comparing a combination of EPA and DHA versus a placebo, and the placebo was margarine that they used. It was over a 16-week period. The treatment group showed a significant decrease in ADHD symptoms measured by improvement in attention and reducing the amount of stimulant medication that was needed. And also of note, omega-3 fatty acids have been found to improve task performance in just your typical developing child. The next supplement here, Bacopi monieri. It's an extract from a plant called water hyssop. This has been used for thousands of years in Ayurvedic medicine for memory, anti-epileptic, and as an anxiolytic, for its anti-inflammatory products, and also for its mild sedating effects. It's been tested on adults, but there's really no randomized control trial to test it on children. And what they found in adults is that it had positive results on memory, mood, and cognition. And then the last one here, melatonin, which I'm sure all of you are very familiar of. It seems to regulate the body's circadian rhythm, but we really have no data to it affecting ADHD. Yes, it can help with sleep onset, but we don't know the long-term effects of using melatonin in children every day for long periods of time. It's only been studied for a short duration. Due to amount of time, I might go ahead and stop there. So kind of in conclusion, pediatric integrative medicine goes over a whole bunch of different categories, everything from mind-body connection, their spirituality, their relationships, their physical activity levels, nutrition, sleep, physical environment. So I wanted to save time for any questions that you may have. Yes, Dr. Keel.
So I'm writing a prescription for melatonin for...
Hang on. Trapped in the back.
So just to kind of clarify, maybe, if I write a prescription for some melatonin, 5 milligrams, send it downstairs or wherever, the pharmacist just going and grabbing something off the shelf, or is it going to be a little bit more regulated what they give out for ferrous sulfate or any of these other things that I give? How does that differ?
So if you're getting it as a prescription from the pharmacy, the USP then has done an efficacy and safety testing on it, anything that's prescribed.
So some of these medications, it would be better for me to write the prescription for the mother to go pick it up from the pharmacist versus buying it off the shelf.
Correct, because you don't know what you're getting off the shelf unless you go ahead and look it up. Dr. Hughes, you're making a face at me.
So I always am interested in what you hear and pick up when you're thinking about different topics. You talk about relationships and exploring that, especially related to child behavior. T. Barry Brazelton died yesterday, I think, or within the last couple days. And I heard a really interesting piece and interview from him yesterday on NPR, and they talked a lot about perceptions of the child by the parent and about their behavior by the parent, and really exploring. His example was he went up and talked to a mom who was about to beat her toddler in the grocery store for grabbing everything off the shelves. And he said, well, tell me what it was like when you went to the grocery store when you were a kid. My mom basically tied me up because I grabbed everything off the shelves. And so that was her model for what to do with your kid in the grocery store. And I found that as a pediatrician who talks about behavior all of the time, so informative. And that gets to your first slide of the integrative history being really important. What are parental models, and what lens are they viewing their kid through?
Thank you.
Any other questions or comments in the room? All right, I think we are over time, so that'll do it.
Thank you.
Thank you very much. All right, if you are on the line, we apologize for not being able to unmute the phones, but you can always email us at outreach@carilionclinic.org, and we can get to Dr. Madea. With that, we're going to disconnect the phone lines now. Thank you all very much for joining us.